Hello, everyone, and welcome back. If you're studying cosmetology, aesthetics, or nails, this series is designed to help you understand the science behind the beauty industry and not just memorize it. Today's lesson is all about infection control, and this is one of the most important chapters in your education because every haircut, every facial, and every manicure and every client interaction begins with protecting health and safety. So let's dive in. So, what is infection control? Infection control is the practice of reducing the spread of harmful microorganisms. And as beauty professionals, our responsibility is to protect ourselves, our coworkers, and every client who sits in our chair. A clean salon builds confidence, but proper infection control protects lives. Certain terms and definitions I need you guys to focus on. An infection occurs when microorganisms enter the body and multiply, causing damage. And our goal is to prevent infections before they ever happen. We have pathogens, is a microorganism capable of causing disease. Whenever you hear the word pathogen, think disease-causing organism. Microorganism is a living organism so small it can be seen with a microscope, and some microorganisms are beneficial, while others can make people sick. Bacteria are single-celled microorganisms. Some are helpful, but others are harmful and cause infection if proper sanitation isn't followed. We have viruses, are even smaller than bacteria and require a living host to reproduce. Because viruses spread differently than bacteria, following proper infection procedures is essential during every service. Fungi thrive in warm, moist environments and commonly affect the skin, scalp, and nails. Cleaning removes visible dirt, oils, product residue, and debris. Cleaning is always the first step because disinfectants work best on clean surfaces. Disinfection uses an appropriate disinfectant to destroy many harmful microorganisms on clean, non-porous tools and surfaces. Remember, disinfecting is not replacing cleaning. It follows after cleaning. Sterilization destroys all forms of microbial life, including bacterial spores. This level of infection control is commonly used for surgical and medical instruments. We have cross-contamination, and cross-contamination is the transfer of microorganisms from one person, tool, or surface to another. This is why we never use the same implement on multiple clients without properly cleaning and disinfecting it. We have PPE, or personal protective equipment. This includes gloves, masks, eye protection, or any equipment that helps reduce exposure to potentially infectious materials. Blood exposure incident. What is it? If blood is present during a service, stop the service immediately. Follow your school's blood exposure procedure and use gloves. Properly contain contaminated materials, clean and disinfect the area, and document the incident according to policy. Why does this matter? Let's connect these concepts to real services. If you're a cosmetologist, every comb, clipper, cape, shear touches the client must be handled with proper infection practices. If you're an esthetician, you're working directly with the skin barrier through facials, waxing, and advanced treatments. Maintaining a clean environment helps reduce the risk of introducing harmful microorganisms. And if you're a nail technician, you're working around the cuticle and surrounding areas. Proper cleaning, disinfection, and safe handling of implements helps protect both you and the client, no matter your specialty. Infection control is the foundation of professionalism. That was a lot. Let's review today's key terms. Infection equals harmful microorganisms entering the body. Pathogen is a disease-causing microorganism. Cleaning removes visible dirt and debris. Disinfection reduces many harmful microorganisms on clean, non-porous surfaces. Sterilization destroys all microbial life. And cross-contamination, the spread of microorganisms from one person, object, or surface to another. Remember this simple order: clean first, disinfect second, and protect always. Ugh, that was a lot. Excellent work today. Every successful beauty professional starts with the strong infection control habits. These practices protect your clients, your coworkers, and your reputation. If you found this lesson helpful, please go ahead and wait for our next episode. We'll continue building your foundation with another core topic from the curriculum. Thanks for watching, by the way, and I'll see you in the next session.